UNMIR will have an even higher standard to ensure that when our staff travel, whether they're traveling to Ghana or to Addis or to New York or to Geneva, that we have in place and rigidly apply these high standards. And UNMIR will not pose any risk or danger of any kind to the people of Ghana. On the contrary, if UNMIR were not here, if the world were not acting now in a very robust, active way to stop the disease where it is, then the risks to the people of Ghana, of Benin, of Togo, of Cameroon, of Indonesia, of Brazil, that's where the risk would occur.
UN Resident Coordinator in Ghana, Susan Ngoji, said rather, Ghana can take advantage of the facility to boost its own preparedness.
UNMIR, as the SRSG has also said, is an unprecedented mission created by the United Nations to deal with this massive challenge that we currently face. And while I recognize that UNMIR will have a regional mandate and will really be focusing on those 3 most affected countries, I think we in Ghana will be looking to see how we could leverage some of the efforts, the capacities of UNMIR, to see how we could strengthen our own preparedness here in Ghana.
The head of mission described the current Ebola outbreak as a multidimensional crisis which surpasses a public health crisis.
It's more than just a public health crisis now. Ebola has become a multidimensional crisis, presenting serious risks in the economic, social, humanitarian, development, political, and security spheres for the 3 most affected countries. The number of deaths now is more from this crisis in the last 6 months in Guinea, Sierra Leone, and Liberia than in the history of the world in the previous Ebola outbreaks.
Fighting the virus requires political will and financial commitment, which the head of mission told journalists have been forthcoming from government.
Many pledges have been fulfilled. We are really now starting to see more and more commitments by donor countries of financial resources as well as other resources. You see strong commitments by the United States in Liberia, United Kingdom in Sierra Leone. The Danish government has provided us a naval cargo ship to be at our full disposal so we can transport cargo along the coast, logistics movements. And the Cuban government has for these very good Cuban medical personnel, most of whom will be working in Sierra Leone.
Explaining the mission's operations here in Ghana, Tony Bunbury said it will only focus on policy and logistic gaps.
UNMIR personnel will not be operating Ebola treatment centers or providing medical care to Ebola patients. We will be involved in the policy issues, the logistics issues, like building the Ebola treatment centers, but then perhaps an NGO or the national health authorities would operate it.